Vaginal Candidiasis. Fungal infection of vagina. What is vaginal candidiasis? Vaginal yeast infection, also known as vaginal thrush, is caused by excessive growth of yeast in the vagina that results in irritation. The most common symptom is vaginal itching, which may be severe. It is not classified as a sexually transmitted infection. However, it may occur more often in those who are frequently sexually active. Treatment is with an antifungal medication. This may be either as a cream such as clotrimazole, or with oral medications such as fluconazole. What is the cause of vaginal candidiasis? The primary cause of vaginal candidiasis, also known as a yeast infection, is an overgrowth of the fungus Candida, usually Candida albicans, within the vaginal area. These yeast are normally present in the vagina in small numbers. The vagina has a complex ecosystem of bacteria, and among them, lactobacilli are typically the dominant species. These bacteria produce lactic acid, which creates an acidic environment that is unfavorable for the growth of Candida. When the balance of vaginal bacteria is disrupted, such as through antibiotic use or other factors, lactobacilli can decrease, allowing Candida to multiply. This overgrowth disrupts the natural balance of microorganisms in the vagina, leading to infection. What are the risk factors leading to vaginal candidiasis? Several factors can contribute to this imbalance and promote Candida overgrowth. These include antibiotic use. Antibiotics can kill beneficial bacteria in the vagina, which normally help keep Candida in check, allowing it to multiply. Hormonal changes. Fluctuations in estrogen levels, such as during pregnancy, menstruation, or with the use of certain hormonal contraceptives, can affect the vaginal environment and promote yeast growth. Weakened immune system. Conditions like HIV, AIDS, or the use of immunosuppressant medications can impair the body's ability to control Candida. Diabetes. Poorly controlled blood sugar levels in people with diabetes can create a favorable environment for yeast to thrive. What are the signs of vaginal candidiasis? Common symptoms of vaginal candidiasis, yeast infection, are itching and soreness. Intense itching and discomfort in the vulva and vagina are common. Abnormal discharge from vagina. The discharge is often described as thick, white, and resembling cottage cheese. Pain during urination. Burning or stinging when urinating can occur. Pain during intercourse. Discomfort or pain during sexual activity is another symptom. Redness and swelling. The vulva may appear red and swollen.